suture material that will be used in the anastomosis. Take a fine pointed blade and make a short stabbing incision in the anterior wall of the simulated artery, taking care not to go too deep and penetrate the opposite wall. Then complete the arteriotomy using angled pot scissors. Aim to open the vessel to between 1/3 to 1/2 of its circumference, depending on how much access is required. Inspect the lumen using a pair of atraumatic forceps, as shown. For primary closure of the arteriotomy, use 2 appropriately sized, double-ended arterial sutures. This allows stitching to begin in both corners of the incision and avoids the final suture being placed at the end of the arteriotomy. Commence at one end of the incision, passing both needles from inside to out. Tie the suture and ensure that each throw of the knot is laid as a proper reef knot, remembering that several throws are required. Then secure it in a rubber shod hemostat. Take a new suture and insert it in a similar manner at the opposite extreme of the incision, once again going from inside to outside with both needles. Then ligate it using a formal reef knot technique. Place one end in a rubber shod hemostat. Take the other needle and begin suturing from outside to inside on the upstream side of the incision. Then suture from inside to outside on the downstream part of the incision. This is because intimal dissection is most likely on the downstream side once blood flow is restored. It is essential that you have an assistant to follow the sutures to ensure that the correct tension is maintained. Continue until you reach the apex of the vessel. Then start again at the far corner. Once again, go from outside to inside on the upstream part of the vessel, and inside to outside on the downstream part of the vessel. Continue in the same manner up towards the apex, being careful not to traumatize the vessel wall with your forceps and rolling the needle through the tissues rather than dragging it through. Once the apex has been reached, the 2 sutures may be ligated. Having flushed the inflow and outflow vessels to get rid of air and thrombus, once again several throws of a well-formulated reef knot are required before the suture material may be cut. The completed arteriotomy can now be seen with no stenosis. A vein patch is the safest way to close an arteriotomy if there is the slightest risk that direct closure will produce narrowing. Start the exercise by lifting the adventitia of the artery, and then, with the blade pointing away from you, use a short stabbing motion with the scalpel. Now, using pot scissors, make an elliptical arteriotomy about 3 centimeters long. Inspect the internal surface of the vessel with care. Excise the lips, so that if primary closure were to be undertaken, it would produce an obvious stenosis in the vessel. A defect such as this should never be closed using a primary suture technique. You can see here that a closure would produce severe narrowing of the vessel. Using the simulated vein provided, cut one end in the form of an ellipse, but leave the other end of the patch long and unshaped at this stage. This section of the patch can thus be grasped without risk of damage to that portion of the intima which will be in subsequent contact with the blood. Using a 5/0 Prolene suture, insert an initial stitch at the shaped apex of the patch from outside to inside, and then from inside to outside at the apex of the arteriotomy. As before, be careful not to drag the needle through the arteriotomy, but roll it through, and then tie the suture using several throws of a formal reef knot. Place one end in a rubber shod hemostat, and then using the free end of the suture, work down the far side of the arteriotomy, from outside to inside on the graft, and then inside to outside on the artery. Try and ensure that the vein patch is bedded down by holding the surplus portion of the patch with your forceps. Continue to work down the far side of the incision, only going through both graft and artery with one sweep, when it is very apparent that it is safe to do so. In normal circumstances, however, it is inadvisable to suture both vein patch and arterial wall with a single traverse of the needle, unless you are extremely experienced. Once the far end of the arteriotomy is reached, the vein graft can be cut to length and shaped appropriately. Now continue to suture round the apex of the graft, taking care how you handle the vein patch now that the excess has been removed. Insert 2 or 3 sutures along the proximal wall of the arteriotomy, and then place the suture in a rubber shod hemostat. Now take the other end of the original suture and start to suture down the proximal wall, again going from outside to inside on the vein patch and inside to outside on the arterial wall. Take care not to handle the suture material or the arterial wall with your forceps. Continue down the proximal wall until the initial suture is reached, and then ligate the 2 sutures together. Do this with a reef knot using multiple throws, laying each one with care. Then cut your suture.